The coronavirus has changed life as we know it across America.
One word, it would be relentless.
Overwhelming. It took over everything.
The worst year ever.
This is truly an unprecedented situation.
The CU Boulder response to COVID was inspiring.
In one word, and I can't swear, it was all about community.
When I first heard about the coronavirus, I was actually in New York to meet with a reporter from the New York Times. And she asked me a number of questions about the virus and how we were thinking about it. And then I noticed, just walking the streets of New York, a number of people wearing masks for the first time. That wasn't happening in Boulder. Shortly after I arrived back to Boulder, that's when things really came to a head.
I remember this vividly. I was at an in-person Boulder faculty assembly meeting. I got a text message that the first case in Colorado had been confirmed. And I thought, well, we're in it now.
Everything across society was about to get turned upside down.
I was in Las Vegas and we just kind of heard some rumblings. And then when we got up the next morning, we were told that they were canceling.
I think the first sign was when one of our lead clinicians came to us and said, I'm doing all these flu tests and they're all coming back negative. You know, what's going on? This isn't normal. And we saw all these flu-like illness and it wasn't flu.
I think people were very anxious though, because this was turning into something that looked like a life and death issue in terms of some of the decisions people might make.
My role as chancellor was to bring together, not to make decisions on my own, but to bring together the subject matter experts and to talk about where we are and what we need to do.
The biggest challenges we faced is really that there really is no rule book for this.
We had been thinking for at least several weeks, more like a month, that we would have to go remote. And that was the phrase that instantly became the phrase on campus. When are we going remote? When are we going remote?
I was walking out at 6 o'clock from Wardenburg Health Center, and we were going home for the night, and an invitation popped up on my calendar that said, discuss sending students home from CU.
I think it was the moment on a Thursday afternoon in March, when we reached the decision of we're going to have to ask the students to go home.
It was overwhelming at the beginning. We had to deal with how do we deliver our curriculum remotely, and this was in less than 5 days. Our faculty and the staff who support our faculty just rose to an incredible challenge.
We already had Zoom. I had never looked at it. I had never used it myself. Nobody had.
Zoom was a technology that was kind of at that third level of criticality. So pre-COVID, we had 15,000 Zoom licenses. After COVID, we have over 60,000 licenses.
When I first heard that classes were going completely remote, it was kind of shocking. I wasn't prepared for it at all. I don't think anyone was. It was kind of just thrown at us. So it was just kind of, okay, this is what we're gonna do, so I have to do it.
The academic experience through COVID was just kind of just disheartening at some points. Looking at a screen for school is kind of different, and it's kind of like hard to adjust to.
The faculty in general was extremely anxious, as was pretty much the country, about COVID and how to respond to COVID. But across the campus, faculty were enormously creative in responding to the students.
As a faculty member, it was a lift. It was a heavy lift to convert content to a virtual structure. I had to become an online educator. And that was not something I had really had any formal training or previous experience with. And in order to do that, I wanted to put in the time, as I think most faculty did, to read, to learn, so that I could in turn deliver the best experience for my students.
The first thing we had to deal with was just figuring out how we continued to meet the mission of the university. How do we make sure that students can progress towards their degrees?
The scope and scale, the logistics, the ordering,
It was really difficult. We actually ordered and dispensed 80,000 cloth masks, I think 175,000 disposable masks, 35,000 N95 masks, 600 fit tests. We created about 750 additional spaces outside.
The facilities folks did the calculations, and our classroom capacity was down to 20% of normal. We went to campus leadership and said, we have to requisition, just like in a war.
We actually took over every single space that was available. So we went from roughly 550 to 1,100 classrooms.
You know, what did we do on a daily basis compared to what we normally do? It was like night and day.
The scope of the financial impact of COVID was over $200 million of revenue loss that we incurred.
And that created an awful scenario where we had to make personnel decisions to try to be responsible, but also to try to be compassionate with our employees, because we had no idea how long this was going to last.
The part that worried me the most was probably getting sick or my team getting sick, taking the virus home, or even my job. You know, what would I do if I lost my job?
Mental health and wellness really became an area of focus for us, and understanding how students were managing during these difficult times. So we made some investments in mental health and wellness support.
I think faculty really poured a lot of their energy into answering phone calls in the middle of the night where students were distressed and didn't know what to do next.
The hardest thing about going remote was definitely not having that like one-on-one interaction with my professors and my classmates.
So some of the things we got right, without question, we stayed focused and we stayed central to the science.
We started with the scientists and said, what do we need to understand about the disease? What do you think we should do to be able to do testing?
We have some of the brightest minds in the country on some of these issues. The individuals in BioFrontiers developed this from the ground up. The individuals in Wardenberg and in Student Affairs and in OIT developed the systems and processes from the ground up.
There were probably 20 or 30 folks who just dropped everything they were doing and they brought all their science to bear to help us create a testing paradigm and a testing protocol that worked quite well, to retrofit all of our classrooms to make them the safest classrooms, I would argue, in the country.
I couldn't understand how this disease was being transmitted so quickly, but then pretty early on it became clear it was airborne. The first thing we took a look at to address keeping the campus safer was to take a look at the ventilation of all of the buildings on campus.
We actually replaced over 19,000 filters and upgraded them to MERV 13 filters. Close to 700 high-efficiency filtration units were installed in some of our older classrooms. We tested and balanced every single system where we have a classroom or a space.
We knew early on that sustained surveillance testing was going to be key to any institutional response to COVID.
Leadership said, we need to figure out how to test. We need to set up a large-scale testing site. And I said, well, what's large scale? Like, what are we talking about? And they said, we need to test hundreds of people a day.
We tried to develop a test that would be independent of clinical supply chains. So we developed a test which we could actually make everything to run the tests ourselves if we had to. And we also developed a test that was based on saliva, because if you're going to test thousands of people a day, nobody really wants to have their nose swabbed. And it's much easier, it's faster and simpler and less intrusive to collect saliva.
The surveillance testing for the academic year 2021 was in excess of 187,000 samples. That's 187 liters of saliva.
It's really important that people from different disciplines came together to try to solve this problem. You know, my lab doesn't have anything to do with COVID generally. We don't work on diagnostic testing. In a crisis like COVID, if you have the expertise and you can step up and contribute, you should probably try to do that.
The origin of the project was, it was kind of a humble email from Roy Parker, just asking of, hey, we've seen some early reports of SARS-CoV-2 can be detected in wastewater. Is this something that is feasible for our campus to pursue? And so then I spent a lot of May and June of 2020 just walking around campus, kind of seeing what the physical layout of the sewage network was. The tests really were telling us on a daily basis what the concentration of SARS-CoV-2 was within wastewater. Is this virus present within this residential structure, or is it absent? We were sitting right outside of essentially people's toilets and kind of waiting for the information right there.
We in Wardenburg had to figure out how to test all of the incoming students for the fall semester who were living on campus. And we pulled that together and staffed it within 2 weeks. I think on our biggest days, we were testing more than 500 students a day. Our mandate is to take care of the students, and when we're asked to figure it out, we figure it out.
I think what we got right is the protocols that we put into place. We still have not had the virus enter our facilities over 16 months, and that's something that we're really proud of.
One of the things we definitely got right was the testing piece. I believe really saved the day because we could test everyone in the residence halls once or twice a week. That, I think, really kept the numbers down compared to other universities across the country.
The big turning point day for me was the first day that we had vaccine available to us at Wardenburg. On that day, I was fortunate that all of my coworkers allowed me to stay in the room with them while they got vaccinated. And I'm gonna try not to cry now, but I cried the whole time because I knew the personal stories of every single staff person who was getting their vaccine. And there were a lot of tears from the individuals when they got their vaccine. I think it was just a big release of fear, of stress, a little bit of excitement that the tide was turning.
At the same time as we were experiencing COVID, we were also experiencing a lot of conversation around racial injustice. We had the death of George Floyd, that me being a black man in this country, black man in Colorado, there were some things that I thought about, there were some things that I seen, some things that I was exposed to that I care not to experience again.
I think we all were shocked by the murder of George Floyd and collectively recognized the time for action is now. We as a university can no longer wait.
The low point in this 18 months for me was the aftermath of George Floyd's murder and the subsequent understanding that there are impacts and there are impacts. We have to address diversity, equity, and inclusion as urgently as we are addressing COVID.
Some of the things that we've seen, and it's still happening right now, with attacks on the Asian community, it's been really hard. I have 2 girls. My wife won't let them go out by themselves. I feel safe in Boulder, and I think we have a safe community, but you never know who you're gonna run into, and so I've never felt that before.
One of the things that I definitely would change, based upon what we know now, is how we started fall semester 2020. We started fall semester 2020 with in-person classes right off the bat. The cases really spiked in September.
There was a point in time when I did say, I don't know whether we're going to be able to get through it. And one day we had 3,700 cases per 100,000 people. And that meant we had to work with Boulder County Public Health to put in some emergency orders in order to drive that back down. And we were able to bend that disease curve back down in a matter of weeks, rather than being in a situation where we had to send everybody home.
The scariest moment for me was seeing that curve of cases rise very quickly in September, and just holding on every day, checking in, midnight, 2 a.m., looking at numbers, seeing if we're seeing any trend. By far, that was the biggest moment of stress.
I was watching the graph of infections go up and up, and I have a scientific background, and I thought if the next day doesn't begin to turn we've lost the game. Luckily, it turned the way we thought it would, and that was pretty dicey. I don't think I slept that night.
In this past year and a half, when I think back to the biggest disappointments, the biggest for me was the March 6th riot up on the Hill.
There was a big party on the Hill, and that party got out of control. And at that point in time, it was no longer a party. It became a riot. There were several hundred people there, and the police were trying to break it up. Unfortunately, some of our students didn't act in accordance with our expectations or the law, and that's just abysmal.
I think that we could have done a better job in making sure that we were gearing or encouraging students to focus on some healthy ways of engaging, some activities, some things that might have been able to be done in the neighborhood. My hope is that the work that we are doing will help students think about their behavior and their responsibility in a community. We had to take care of not just 34,000 students, but also 10,000 employees and thousands of neighbors.
We have 35,000 students on the campus, and this involved around 500 students. So it's a small number compared to the total. But that was so disruptive for the campus, for the city, for the Hill area. And to me, that was the biggest disappointment.
What made me sad was really the shootings in Boulder, that happened at King Soopers. That was probably the one thing during this pandemic that was the most difficult, and that was a real sad moment. I'm sure it was for a lot of people.
Another disappointment for me these last 2 years was not having live commencement for our graduating students.
One of the biggest regrets I have in the communications we did during the COVID response, I would say it was how we communicated commencement and the amount of disappointment and pain and frustration and loss that was expressed back to us.
My best friend just graduated this spring, and she, we had a small dinner because she couldn't attend her own commencement. It was kind of upsetting. She had worked so much for this, and she did it in 3 years. She was really working herself, and to not have that commencement was really upsetting.
I always talk about think university first. Think about your university before you think about your department or your unit or your position on the campus. Think university first. And with COVID-19, everyone thought of university first.
One of the stories about deans in the past is that everybody had their own castle, right? People really fought for their own schools or colleges. So I think there are ways in which some of those barriers that had been set up before broke down, and we were able to work together and see our common goals more clearly.
We have committees on committees about forming committees about committees. But in order for us to be successful during COVID, we had to get subject matter experts on board and empower them to do their work.
Although there is the bureaucratic structure set up, it behaved very collaboratively, where it was never a no and the door would close.
We can act and move much more quickly and have a bias for action and break down some silos and barriers.
I think we really set the bar not only for the university, but for other universities, other institutions. The relationships and the way we interact with each other during this crisis is really gonna pay dividends for us moving into the future, because we found out that we can be effective, we can be nimble, that we can work together.
I think people will mark time now in terms of pre-COVID and after COVID. It's a defining moment for us.
I hope that what we learned is that we have to care for each other.
I think one of the biggest things that I took away from this experience is actually feeling more connected to students. And I feel like students were, in some ways, more willing to be vulnerable and engage because they were virtual.
Lessons that I learned personally were patience. You know, you're not gonna get everything when you want it, how you want it, you know, in life.
I am humbled at the resiliency of people to persevere and to want to be part of something bigger than themselves and to roll their sleeves up and to say, what can I do to help?
I am proud of just that nobody got sick. And, we're all here. And my whole team's, I can say we're alive and we're healthy and none of my team members got sick.
When we come together collectively, we can accomplish anything.
We will listen more actively to our constituents. We need to meet people where they are, and a place like this has a lot of places for people to be.
I'm very optimistic that a lot of this is going to carry over into the future. I think the worst thing that could happen, or the most disappointing thing that could happen, is if we slip back into our pre-pandemic ways.
The biggest lesson I think we've learned from the COVID pandemic is trusting experts.
I'm really appreciative of how this university turned quickly, early on, to the research community and the experts who worked here.
Nobody said, no, we can't do that. And sometimes we had to solve problems in 24 hours, and people were terrific.
COVID over this past 18 months has made me really appreciate how important that human connection is.
When I think about these last several months, over a year, and the effect of COVID on me as a person,
my one message to our faculty, to our staff, to our students is very simple. Thank you.